Your referral sources are calling with Medicare Advantage patients, but you're terrified of the billing nightmare that could destroy your cash flow. Here's the brutal truth. With 54% of Medicare beneficiaries now on Medicare Advantage plans, refusing these patients means watching your referral relationships evaporate to competitors who can handle the complexity. In the next 5 minutes, I'm going to show you exactly why home health billing for Medicare Advantage is make or break for your agency's survival, and what you need to know before you say yes to that next BCBS, Aetna, Cigna, or UHC referral. Picture this scenario. Your best hospital referral source calls with a discharge. Great patient, perfect for your services, but they have a Medicare Advantage plan. Do you accept, knowing the billing complexity could create a cash flow disaster? Or do you decline and risk losing that referral relationship entirely? This decision point is where many home health agencies either thrive or die. Here's what's happening in the market right now. Medicare Advantage enrollment has exploded to cover over 34 million people. That's 54% of all Medicare beneficiaries. This isn't some niche segment anymore. This is your patient population. And here's the kicker. Your referral sources don't care about your billing challenges. Hospital discharge planners work with patients across all payer types, and when they develop a relationship with your agency, they expect you to accept patients regardless of insurance. If you can only handle original Medicare patients, you're effectively telling referral sources you can manage less than half their discharge needs. The consequence is predictable. They move on to agencies that can handle their full patient mix. You don't just lose individual Medicare Advantage patients, you lose entire referral relationships. That discharge planner who sent you 3 original Medicare patients this month won't send you any next month if you turn down their Medicare Advantage referrals. But here's where it gets really challenging. Home health billing for Medicare Advantage isn't just a little more complicated than original Medicare. The complexity creates fundamentally different operational challenges that most agencies don't see coming until their revenue stops flowing. Let's start with prior authorization, the single biggest difference between original Medicare and managed care billing. Original Medicare rarely requires prior authorization for home health services. Medicare Advantage plans require it constantly. And here's the brutal reality. 90% of Medicare Advantage plans require prior authorization for home health care. Services delivered without proper authorization don't get paid, ever. There's no appeals process that recovers revenue for services you've already provided. When your intake staff accepts a patient without securing authorization first, you've just committed to providing care that will generate zero revenue. But it gets worse. You might get authorization for an initial period, then find yourself unable to secure approval for continuation care your clinical team knows is necessary. Do you continue providing medically necessary care without authorization and accept the revenue loss, or do you discharge patients prematurely and potentially harm your referral relationship? Now here's something that catches agencies completely off guard: systematic underpayment issues. Original Medicare accesses state OASIS databases to validate HIPPS codes during claims processing, ensuring accurate case mix payment. Medicare Advantage payers and commercial insurers can't access these databases. The result? They pay using generic HIPPS codes, which often results in significant underpayment to home health agencies. This isn't occasional underpayment, it's systematic. Your agency submits claims with accurate HIPPS codes reflecting the actual complexity of care provided. The payer processes the claim using generic assumptions that undervalue your services. The payment you receive falls short of what the care should have generated based on proper case mix adjustment. Recovering that underpayment requires appeals, which consume staff time and resources while that revenue sits in accounts receivable, deteriorating your cash flow. But wait, there's more complexity. Commercial payers and Medicare Advantage plans frequently conduct retrospective reviews months after initial payment. You receive payment, close the claim, and move on. Then 6 months later, you get a recoupment demand requiring you to return the payment and submit extensive documentation to potentially recover it. If the payer identifies an issue more than 1 year after service delivery, you can't resubmit a corrected claim because timely filing deadlines have passed. That revenue is permanently lost. Here's something that makes this even more complicated. Medicare Advantage, BCBS, Aetna, Cigna, and UHC aren't single entities with consistent rules. Each operates multiple plan products, and billing requirements vary by plan even within the same parent organization. BCBS of Texas may have completely different authorization thresholds than BCBS of Florida. Your billing team can't develop a single BCBS process. You need state-specific and plan-specific processes for each entity. Many agencies turn to billing companies when they realize this complexity exceeds internal capabilities. But here's the problem. Most billing companies fail at managed care billing because they lack operational knowledge of how home health agencies actually function. Generic medical billing companies understand claim submission mechanics, but miss the operational integration required for successful managed care billing. Prior authorization isn't just a billing function, it requires coordination between intake, clinical assessment, care planning, and billing teams. Only billing companies with actual home health agency operational experience understand the workflow integration required. Someone who has managed a home health agency knows when authorization requests must be initiated, what clinical information needs to be captured during admission, and how to structure visit schedules that align with authorization parameters while meeting patient care needs. Here's what agencies often catastrophically underestimate: the onboarding requirements when adding Medicare Advantage and commercial payers. The assumption that we're already set up for billing creates permanent revenue loss. When agencies go live without proper preparation, a significant portion of early claims become unrecoverable. Many agencies discover that 20% or more of accounts receivable from initial commercial payer onboarding can't be recovered because retroactive authorization was impossible to obtain. By the time agencies realize their billing setup was inadequate, timely filing deadlines have often passed for the earliest claims. You can't go back and resubmit properly because the filing window has closed. That revenue is gone, not deferred, not delayed, but permanently uncollectible. Successfully billing Medicare Advantage and commercial payers requires two critical components most agencies lack: deep operational experience in home health and powerful data analytics systems. Operational experience means understanding home health workflows at a granular level. This knowledge can't be learned from billing manuals, it comes from actually managing home health operations. Data analytics provides the visibility to track performance across multiple payers simultaneously, monitoring authorization status, approval rates, and days in accounts receivable by plan. But here's the opportunity side of this challenge. Home health agencies that successfully navigate Medicare Advantage and commercial billing complexity gain significant competitive advantages, while competitors turn away managed care patients or struggle with cash flow disasters. Agencies with strong managed care billing capabilities capture larger market share and build stronger referral relationships. Referral sources value reliability above almost everything else. When you demonstrate consistent success with Medicare Advantage, BCBS, Aetna, Cigna, and UHC referral sources send more patients across all payer types because you've eliminated their uncertainty. The shift toward Medicare Advantage isn't temporary. It represents the future of home health reimbursement. Agencies that successfully handle home health billing for Medicare Advantage position themselves for growth by capturing expanding patient populations and strengthening referral relationships. Agencies that can't master this complexity face shrinking opportunities and weakening competitive positions. The challenge isn't insurmountable, but it demands either significant internal capability development or partnership with billing specialists who combine operational home health experience with sophisticated data analytics. Want to see where managed care billing complexity is costing your agency revenue? Book a quick call and we'll analyze your specific situation, showing exactly where authorization gaps, underpayment, and process issues are impacting your cash flow across Medicare Advantage and commercial payers. Don't forget to subscribe for more insights on home health billing. Drop a comment about your biggest Medicare Advantage billing challenge, and check out our next video on mastering prior authorization workflows that protect your revenue.